If something lasts more than 4 to 6 weeks and it does not respond to over-the-counter medications such as acetaminophen,
Something very common. Almost everyone gets joint pain at some time. So when should joint pain worry someone enough to see a rheumatologist?
stiffness, especially if it's in the morning, people can have rheumatoid arthritis without having those testing. The confused immune system, where immune system attacks the joints.
Public figures like Selena Gomez brought awareness to it, after sharing her health journey.
So it's hard to conceive when someone has active rheumatoid arthritis.
Stiff in the morning, tired all the time, being told it's stress, aging, or all in your head. Stay with me because today's episode might just be for you. Welcome back to Myths to Medicine, and today we're talking about a field that many people have heard of but may not fully understand: rheumatology. When people hear rheumatology, they often think that's arthritis or that's just joints. But as we'll learn today, rheumatology goes far beyond joints. And so I'm really excited to welcome Dr. Ofelya Gevorgyan, a board-certified rheumatologist based in Tacoma, Washington, who has been in practice for more than 6 years. She has extensive experience treating patients with rheumatoid arthritis, osteoporosis, among other autoimmune and conditions. She's going to help us understand what this field really covers, when joint pain should worry us, and what patients need to know before symptoms get worse. Doctor, thank you so much for joining us today.
Good morning. It is my pleasure to join you this morning, and I feel very privileged to be here and to talk about the topic that is so close to me. I just want a little bit to elaborate about what rheumatology is. As you mentioned, that really sometimes people don't understand what it encompasses. It's a field that addresses wide variety of conditions that affect multiple organs and systems. The majority of these conditions have something in common. They are caused by confused immune system. When I say confused, immune system is we're born to protect us against infection, but sometimes it does get confused and attacks our own organs and systems and causes autoimmune disorders, autoimmune diseases. Rheumatology deals with manages those conditions. And because it can present with wide variety of symptoms, and sometimes it can be very vague and frustrating for even physicians. But for us rheumatologists, that's a very challenging and interesting part. And for me, it was one of the reasons I chose it, because a lot of time you play medical detective work to try to understand where is the disease coming? Is it something we can treat or not? Is it rheumatological or not? And another aspect that is something that really was important for me when I chose this field is that because most of our conditions are chronic conditions, it allows us to gives us opportunity to establish long-term relationship with patients, to get to know them and actually treat the patients, not the disease, which is one thing that's very important for rheumatology.
So in a way, you build relationships as you go along the way also.
Yes, it's very important because diseases do not present the same way from one patient to the other. And we need to treat the patient, the individual, not the disease. It's different from other specialties.
So, and it also, from what you've just said, it also goes, it's not just joints, it's beyond joints. It's not just like, oh, my knee hurts.
No, it does present with wide range of multiple organ system involvement: skin, nervous system, kidneys, heart. All systems can be affected by rheumatological conditions, by immune. But different in a lot of other specialties, they also deal with managed autoimmune, immune-mediated diseases, such as the endocrinology. They treat thyroid disease, which can be immune-mediated too. But in our case, it's disease that does not only affect one organ. It's not just a joint or just a thyroid. Most of the time, it's a systemic condition that can affect more than one organ.
That's good to know. And thank you so much for at least giving us that brief overview of what rheumatology actually encompasses. Like I said earlier, people, they've heard the term, but they don't really understand what it is. And I can say that for myself also. So one of the things when we hear about rheumatology, like the first thing that comes to mind is joints. That's something very common. Almost everyone gets joint pain at some time. So, when should joint pain worry someone enough to see a rheumatologist?
Yes, that's a very good question. There are several factors to consider. The duration of joint pain. If something lasts more than 4 to 6 weeks and it does not respond to over-the-counter medications such as acetaminophen or non-steroidal anti-inflammatory medication, that's something that you need to seek. Patients need to seek attention. And it doesn't have to be rheumatologist. They can seek attention from their primary care physician first. And then they can determine if they actually need to see an expert rheumatologist or not. If they're, as we said, it's a systemic, most of them are systemic diseases. So if the joint pain is accompanied by systemic symptoms, fatigue, unexplained fatigue, weight loss, other organ like skin conditions, skin lesions, or neurological symptoms, or appetite problems, constitutional decreased appetite, those are the times that you definitely want to seek attention. Also, if you see joint pain, arthralgias, aches are accompanied by changes in color, if they are hot, if they feel hot, or they not only feel but look hot, their deformities, movement, inability to move them, stiffness, especially if it's in the morning, because that's something inflammatory conditions cause it. The more stiffness is in the morning and takes more than 5 minutes to get better. Those are the times that you definitely want to seek attention. First of your primary care physician, and then they can guide if you need to see a rheumatologist or not.
Okay. So, it's not just pain, there has to be a certain pattern around it. Skin
If pain
conditions.
is more than long, it's always good idea to check it out.
Hmm.
But if pain is not only pain, but it's also accompanied
So,
by visible changes in the joint and other
mhm.
systemic symptoms, you definitely want to seek medical attention.
That's helpful to know. And it also brings me to my next question because I believe that's the biggest confusion out there. Like my grandma said she had arthritis, and my cousin says she has arthritis. So, what is the difference between regular arthritis and rheumatoid arthritis?
Right. So regular arthritis,
Mhm.
it's the osteoarthritis. It's the arthritis that is caused by wear and tear that everyone gets eventually, sooner or later. It's caused by mechanical factors, but the joints, it's like the same way all other organ systems get worn, get wear and tear over time. Joints
Yeah.
do that too. So that's osteoarthritis. It's very different from inflammatory arthritis, where there is an inflammation in the joint, and that can happen at any age, in children as well. It's
Oh,
caused by confused immune system, where immune system attacks the joints, doesn't recognize them as their own part of their own system attack. So it's inflammatory. Rheumatoid arthritis is an inflammatory condition, and it is associated a lot of times with systemic symptoms. And wear and tear is just a mechanical. It's not just, it's a very important condition because it affects many more people and it does affect their quality of life. It's an important type of arthritis, but it's not related to inflammation. It's not what caused by your own immune system going against you.
hmm. So, one is mechanical and then the other is
Inflammatory.
yeah. Okay. And also, coming to know that rheumatoid arthritis can affect at any age. When I was prepping up for this episode, that was kind of scary that it can affect at any age. That was concerning. So, I believe early diagnosis is very important when it comes to rheumatoid arthritis. What are the early warning signs of a rheumatoid arthritis?
Yes, early diagnosis is important, especially nowadays, because we have such a wide range array of treatment options. If it was 50 years ago, really that wouldn't make significant difference,
Mm.
except that it would help with symptoms. But right now, at our current time, we have so many options to treat, and if we start treating early, will prevent damage and joint deformity. That's why early diagnosis is very important nowadays. The early symptoms, classically, as known, but it also comes historically, it's the distal joints, like hand, feet, small joints that
Yeah.
are symmetrically both sides of the body, right and left, affected, and are associated with swelling, morning stiffness. This is the classical presentation, but it's not always the early presentation. So when early rheumatoid arthritis doesn't always present with symmetrical polyarthritis in the hands and feet. And stiffness is a very important thing. Morning stiffness, as we talked about it earlier, if it's prolonged morning stiffness, if patients wake up early with stiffness and they need like more than half an hour, 45 minutes to walk or to, take a warm shower or wash their hands under warm water. They describe it very often like that before they can actually move. It's an important sign. But also, it can present with just one joint being swollen for 6 weeks. That's an early sign too. So patients need to seek attention. It's not a classical presentation, but can present like that. It can cause something called palindromic presentation when one joint you have symptoms for 6 weeks or even less and then goes away and then 6 months it comes back. That's also can be early sign of rheumatoid arthritis. So again, anytime the joint swelling happens, morning stiffness, and it lasts more than 6 weeks, it's better to seek medical attention to get it checked out.
Okay, so it's not just pain, but then all these confounding factors that come along with it that helps us to determine, okay, maybe,
Yes.
these are the symptoms. Okay. So let's just say I come to your office with all these symptoms, I present myself with these symptoms. How do you diagnose arthritis and what are the different blood tests that go along with it?
It's one of the most important questions. The gold standard of diagnosing rheumatoid arthritis is judgment, clinical judgment. When the rheumatologist sees the patient, examine the patient, and um, it determines that the presentation is consistent with rheumatoid arthritis. A lot of things that we're familiar with, there are classification criteria, like certain number of swollen joints, certain duration. Those are classification criteria that are used to involve patients in the clinical studies, but they are not the some people don't meet them, but they still have rheumatoid arthritis. So
Uh-huh.
gold standard is clinical judgment, being
Yeah.
evaluated based on clinical symptoms and physical examination findings. Then, as a supportive tests, we can get blood tests. There are
Right.
certain autoantibodies that are detected in up to 80% of patients, such as
Oh.
rheumatoid factor and anti-CCP antibodies, a
Mhm.
cyclic citrulinated peptide. But there are some others, they are developing newer, but those are more commonly tested. And they are present only in 80% of patients. When they are present, it's helpful, but sometimes they are not. So people can have rheumatoid arthritis without having those tests in the blood. Also, we check for inflammation markers. They're oftentimes elevated, but sometimes they can be normal as well. And then we use imaging to confirm the diagnosis or rule it out. X-rays, they are not very helpful in early rheumatoid arthritis because by the time X-ray shows something, it might be already late to start treatment. Uh, to prevent damage, not musculoskeletal ultrasound can be helpful in cases when you're in doubt if there is an inflammation in the tendons and the joint, and rarely MRI also can be helpful as a test to confirm the diagnosis. Yeah, so clinical judgment, clinical presentation, and supportive blood and imaging studies. That's how we diagnose it.
That's really helpful for patients to understand that it's not a single yes or no answer. Like you said, a single blood work test might not work. It might not be present. It might not show up in the blood test. And from what you've said, it sounds very um, comprehensive and not just like straightforward.
Yes,
Mhm.
yes.
Yes. And also for
And
listeners listening, don't self diagnose, based off of
exactly.
Google.
Yes, and it can be frustrating sometimes when patient experience all the symptoms and then they have blood work and it's completely normal and then they question, do they have the disease or do they don't? How come the test is? Because it's not just like blood tests. It's
Right.
different from other condition, thyroid disorder. If it's high, it's high. If it's low, it's low. But in rheumatology, it's not that clear.
Right.
It's just only a small part. Blood test is a small part of the whole picture.
Like you said, you really have to wear your medical detective hat to
Yes.
get the to come to a
That it can
conclusion.
be very frustrating for
Mhm.
patients
All right.
to, understand that and understand and we understand that when the
Exactly.
treatment.
Because as a patient, I would want the answer quick. Tell me what is wrong with me because they've been suffering for such a long time. So they would expect like quick answers. Well, you got to go to a
Yes.
doctor. I'm going to get my answers right away.
Yes, yes. That's a very big part of it.
Yes. Yeah. And I can understand. Like it might be a lot of explanation on your part to tell them and make them understand and see the full picture and why we should not hurry and come to a conclusion.
Exactly.
Mhm.
Exactly. Patience. And it does require a lot of patience.
Okay. That's
Patients
tough.
from patient side, because they also need to be patient and wait, and sometimes we say we need to wait and see how the things change, how things develop, and it's frustrating.
Yeah. And if you're trying to do multiple tests, clinical judgment, ultrasounds, and all of that, then that's a lot of one after another because those appointments also don't happen like back to back. So it sounds like a waiting game also on the patient's part that and can be
Yes,
frustrating.
unfortunately, it takes time, and some of it is just because of the how overwhelmed the rheumatology practices are, and how much is waiting, and that's one thing. It's really unfortunate. Yes.
Right. Exactly. As I was preparing for this episode, one thing that really caught me off guard was young women are also very much diagnosed with rheumatoid arthritis, even in the childbearing years. Which brings me to question: do these symptoms worsen during pregnancy? And more importantly, does it affect their fertility?
Yes, it's a good question. There is a myth actually that rheumatoid arthritis goes away, symptoms go away during the pregnancy. In reality, in about a little bit more than half of the patient actually do experience improvement in the symptoms when they are
Hmm.
pregnant. But it's only half. There are a significant number who will flare, especially those who stop the medications when they get pregnant, and who do have improvement in the symptoms sometimes experience very severe flares right in the postpartum period. That really affects their ability to care for the baby, and it can be quite frustrating. Rheumatoid arthritis itself does not affect fertility, so
Okay.
it does not make patients infertile. But when it's active, it can cause difficulty with conception. So it's hard to conceive when someone has active rheumatoid arthritis. So it has to be planned in advance. It's very important for patients with established diagnosis of rheumatoid arthritis to plan pregnancy in advance, to be in a well-controlled state, and also to consider what medications they are taking. So a lot of time, the medication that they take to treat rheumatoid arthritis can affect the conception and the course, because they have need to be stopped. Some medication need to be stopped well in advance before they plan to conceive. So if I summarize, no, it does not affect the fertility per se, but it does affect the whole process, and it
Mhm.
needs to be considered. And it does not, it may, more than half of patients may experience improvement in their symptoms, but it's not guaranteed. And still, we need the individual approach to monitor the symptoms and continue treatment in all patients.
That's very important and very nice clarification for our listeners. So we have to be a little proactive, I suppose, when you are planning a pregnancy if you have an active rheumatoid arthritis, but it does not affect your fertility per se, which is a relief
Yes, patients still
considering
can get
starting a kid.
pregnant
Yeah.
when they have active disease, but important to be treated. And because if patients have a flare during pregnancy, it's associated with high rate of preterm labor
Okay.
and premature infants, which we would ideally want to prevent if the disease is controlled and treated.
Mhm. Exactly. And talking a little about treatment, I believe we've come a long way from for pain. Okay, let's just give ibuprofen. So, what are the treatments available today?
Yes, as you said, historically there has been a significant change, evolution of treatment of rheumatoid arthritis. Just 30, 40 years ago, it was just primitive symptom control,
Hmm.
where just pain, gold, the one like historical treatment, gold shots people used to get until like 80s, the 1980s, when the first medication that could slow down the progression came, the methotrexate. So
Okay.
currently we use medication that are called disease modifying anti-rheumatic agents. They are not just controlling the symptoms,
Hmm.
but they change the course of the disease, target the mechanism of the disease. So they
Right.
prevent flares and prevent the damage to the joints. It's not just controlling the symptoms. And disease modifying uh, anti-rheumatic drugs, or DMARDs, have also evolved over time historically. First, it was methotrexate. We still use it a lot of time, the first agent to ever use.
Hmm.
In 1998, biologic medication was available. Proof biologic medication are DMARDs that are a synthetic engineered proteins that target certain immune parts of the pathology of the attack on the joints. Certain mechanism they can affect the T cells, B cells, their engineered proteins, and more recently the synthetic targeted DMARDs like JAK inhibitors, which are taken orally, and they affect the mechanism of the immune response inside the cell. So it's evolving. There have been exciting developments, and we do have multiple choices. So it's come from just simple primitive pain control to targeted molecular medicine that can have individual choices for patients.
Yeah, it sounds like it's come a long way from pain control to preventing long-term damage and also looking at improving the quality of life of the patient.
Yes, yes.
Mhm.
It's just not because a lot of time you can control the pain, but even when the pain is controlled, the disease continues to progress and eventually leads to joint deformity and function loss.
Right.
So that's why disease modifying anti-rheumatic drugs are so important to start as early as possible to prevent that damage.
Yeah, which brings us to back to why it's important to recognize the symptoms early and start the treatment early.
Yes.
Because we have those um, medications available now to improve your quality of life considerably.
Yes.
Exactly. Now, I want to shift the gear to a condition called lupus. Many people first learned about lupus when public figures like Selena Gomez brought awareness to it, after sharing her health journey. Many people still do not understand. They've heard the term lupus, but they don't really know anything about it. So, in simple terms, what is lupus and what are the early warning signs and symptoms?
Lupus, it's that's prototypical autoimmune disease. When your own immune system produces autoantibodies against your wide range of organs and systems. It's it does not have one symptoms that could be early warning sign. It presents very differently in patients, in different patients, and it a lot of times mimics other medical conditions. It's very hard to diagnose just based on what joint pain or skin lesions. It is multi-system disease. It affects more than one organ, and it's very important to not self-diagnose
Mhm.
lupus just because someone has a skin rash on their face. It's very important to seek medical attention and get diagnosis established on time and correct diagnosis because it does affect the further treatment. So there is not really one symptom that I could mention that, oh, this is if you have, you should be concerned. It's lupus. It's a rare disease that can mimic a lot of other conditions. And most of the time, it's not lupus when someone presents with that symptom, but you need to have comprehensive evaluation when you suspect it's a lupus. It's not just one blood test.
It's probably why it makes it difficult to pin it down
Yes, of conditions.
and is very challenging for, of course, you as well as the patients because, like you said, it mimics so many other conditions.
Yes, yes, it is. It is challenging, and because it doesn't present the same way. Someone can present with lupus with just lesions on facial rash and joint pain. The other can present with kidney failure. So it's very two different presentations, and both can be just caused by lupus. So we can't just pinpoint one warning sign, or you have this, you likely have lupus. Because if you have a skin rash, probably not lupus. If you have kidney disease, probably not lupus. But lupus can present with kidney failure and can present with skin rash. So you do need a comprehensive evaluation
Oh,
to
wow.
diagnose the disease.
Similar to other people, my knowledge of lupus was also very vague. And I am, to be honest, I'm mind blown hearing what you said just now. Wow, that is very challenging.
It is. It is.
It is, yeah. So when I was still researching about lupus, I found out that it affects more women than men. And are those symptoms different for women from men? Is it different?
Yes, it is. Lupus is more common, about
Hmm.
9 times more common in women, especially childbearing age. And that kind of gives us a clue that the reason it's more common is probably one of them is hormones, estrogen. Estrogen is the hormone that can that is associated with pathogenesis of the disease. Also, some genetic mechanism, like women have two X chromosomes, while men have one X and one Y chromosome, right? So in women, that one of those X chromosomes usually is silenced, but in lupus and a lot of autoimmune conditions, it's suspected that that process is gone wrong. So that's why it's more common, because the mechanism involves silencing one of the X chromosomes. That's not happening in men. That's not reason why. That's a little complicated, but that's not a reason why lupus is more common in women, especially in childbearing age. It presents symptoms are also a little different. If it does happen in men. Definitely does happen in men, and it's more aggressive if it happens in men. The mechanisms are different. It's not the estrogen and not the X chromosome. They have other genetic mechanism, and it does present more often with organ threatening, like heart or kidney or lung involvement, than in women. So although it's less common, it tends to be more aggressive.
Sounds like biology is stacking the deck for us women and affecting more. um, Lupus now, uh, is it hereditary and is it curable?
So hereditary in a sense that you inherit from your mother or father? No, it's a polygenic disease. So you don't inherit it from your parents, but you inherit genes that predispose you to develop it in the future. But it's not enough. You can carry the gene that predisposes you to develop lupus all your life and never develop, because it's not the only a part of it. There is other environmental, infection, nutrition. Those are the things that can kind of serve as a second hit for you to develop lupus if you have the genetic predisposition. So in a sense, you don't inherit it from your parents, but you do. It's genetics plays an important role, if it makes sense.
Yeah. Okay. It can be embedded. It can
Yes.
be silently in your body, but
But you don't have to have it if your parents have. It's not
Right.
like the simple genetics that we imagine
Yeah.
in a lot of different condition, genetic disorders. Regarding the cure, it's a chronic disease. As in all chronic diseases, there's no cure per se. Uh, except infection. Besides infections, there's no high blood pressure is really not cure. It can be controlled. Diabetes there's no cure. It can be controlled,
Yeah.
right? The same as with lupus. The goal is not to cure. The goal is to manage symptoms, improve quality of life, prevent flare-ups, prevent organ damage. And we have medications and advice and counseling and methods to make that happen. So no cure, but it can be managed nowadays, and it can be controlled, and the quality of life can be improved.
Yeah, that's a very practical way to explain it. Not a cure, but we can definitely improve.
Yes.
We've been talking about it like rheumatoid arthritis. It's not only a joint disease. Inflammation, it can affect the whole body. Is it true that rheumatoid arthritis patients have a high cardiovascular risk, even supposedly more than people with diabetes?
It is true that rheumatoid arthritis is an independent risk factor for cardiovascular disease. Yes, the risk of cardiovascular disease is comparable, maybe a little less than diabetes. Rheumatoid arthritis itself is associated with higher risk of developing diabetes. So patients who have rheumatoid arthritis should be screened for it. But we tend to think that patients who have rheumatoid arthritis, their vascular age is 10 to 15 years more than their actual age. So that it does increase the cardiovascular risk. And the mechanisms, yes, like the systemic inflammation, it's still controversial if controlling it can decrease the risk, but it's very important to consider that increased risk in the management of the disease, to be proactive to prevent cardiovascular disease in patients with rheumatoid arthritis. A lot of time also the medications we use can increase the risk. So to be mindful when using the medication like prednisone when treating rheumatoid arthritis. So yes, it's not a myth. It's definitely a reality. The risk is, I wouldn't say it's higher than diabetes, but it's comparable.
I guess that's reassuring to know, and also a big takeaway from this episode. Like, it's not about just painful joints, it can be connected to heart health as well. Moving on to another term that goes on parallel when we talk about rheumatology is gout, disease with the worst PR history. Apparently, it's also called as the disease of the kings because it's been
Used to.
attributed to eating too much meat and seafood. So, is gout a form of arthritis?
Definitely, gout is a form of arthritis. It's a little different from the diseases you were talking about, because the main mechanism is not the immune system attacking your joints, but it's a metabolic disease. Well, it's caused by excess uric acid in your blood. So, which is,
Oh.
but the presentation is they are both inflammatory arthritis. The gout also causes very significant inflammation in the joints, but the cause is the uric acid being very high in blood and not just immune system attacking your joints. Gout, the presentation is quite different. Gout usually presents very acutely. They wake up with acutely swollen joints, severe pain, while rheumatoid arthritis is more more subacute, takes weeks and months before it develops. So, and then patients usually do have the triggers for gout to develop most of the time. When they describe the picture, when they ate the seafood and the next morning they woke up, or drinking alcohol is one of the biggest triggers. Yes, it definitely type of arthritis, very different from other rheumatoid arthritis and lupus associated arthritis.
It is there, but one is very sudden and one
Yes,
goes
very acute.
slowly
You
over time.
cannot, yes, patient with rheumatoid arthritis can be in pain but still function. If you have your knee attacked by gout, it's unlikely you'll be able to walk.
Oh.
That's no way. It's very acute and severe presentation,
Oh.
and they seek medical. They won't delay seeking medical attention because they know it really affects the quality of life and function.
Right. Okay. That's something I wasn't aware of. No. To know the comparison. One's very
And
sudden, one's
yeah.
the
And the
joint is
disease of
shattered.
kings or podagra, it was also known, obviously because kings were had back then access to more meat and alcohol than poor people. But
Yeah.
in reality, it's right now that's irrelevant. It can affect everyone.
Oh, okay.
We have risk factors.
Okay. So that's a myth now.
That's a myth. Myth that it's a king disease of king. Yeah, it's a history
Yeah.
rather than.
So now we're talking about foods, very much associated with food gout. What are
Yes.
the foods to avoid with um, gout? And a very specific listener question: is tuna bad for gout?
Yes. As we say, as a metabolic disease, it's excessive uric acid in blood. So the source of uric acid in blood is purine. So anything
Hmm.
that's high in purines, any food that can trigger gout attack. And patients actually have gout already developed by just eliminating that food from their system would not stop gout attacks completely. But those are predisposing factors to attack. So what foods are rich in purines? Those are uh, meat. Red meat is very
Hmm.
rich in purines. Certain fish, salmon is also, and tuna is rich in purines as well. It's
Oh,
moderately too high, so it
okay.
can. It doesn't mean you have to avoid it,
Hmm.
but it can. It should be used in moderation, like 1 to 2 servings per week. And it's also important what type of tuna. Like raw tuna, definitely
Uh-huh.
higher risk. If it's canned tuna, it's less risk. 'Cause again, the amount of the purines in them. Other food that can trigger organ meat, like liver, if patients eat liver, certain dishes. Some
Yeah.
certain cultures they use that.
Hmm.
So this definitely one that can very rich in purines. Beer, alcohol, especially beer, it's very high risk for a flare up. Um, but the food that's less like low, the dairy food is not as good because it's
Hmm.
not rich in purines. So that's something where I would be to include in the diet. Fruits and vegetables, they're definitely good. Yeah. So if you have to highest risk is the red meat and alcohol.
Hmm.
Red
Yeah.
meat, a certain fish, definitely. I wouldn't think of tuna when I would think about fish that you need to avoid first. Like shellfish would be probably the one. But yes, definitely tuna is somewhere there too that you have to
So
restrict the amount intake.
not a lifetime ban, but in
No, 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 it's
moderation.
not. It's just moderation. You still can have it, but the way it's prepared is important, and the amount, the
Yeah.
dose.
All right. Continuing with the food, the internet right now is sort of obsessed with anti-inflammatory diets. Um, Turmeric lattes, celery juice. So do these diets actually help? And what kind of food should we avoid for patients with rheumatoid arthritis?
Yes, that's not a myth. Food
Not.
does matter. It's very important. Anti-inflammatory diet is very important in the management of gout and rheumatoid arthritis.
Mhm.
It's it not. It's very important to understand that if someone already developed rheumatoid arthritis, just eating healthy food and eating anti-inflammatory diet, that's not enough. At that stage, when they already have the disease, that's not enough. It cannot replace medication, but it can improve the symptoms and try to control flare-ups. There are some studies actually suggest that patients who followed anti-inflammatory diet, it can actually prevent the development of rheumatoid arthritis. But what is anti-inflammatory diet? It's very closely related to Mediterranean diet, like diet. It's a whole food. It needs to include healthy fats and rich in omega-3 fatty acids. It's certain fish, salmon, mackerel, that's rich in those plant-based omega-3 fatty acids. That could be chia seeds, walnuts, um, extra virgin olive oil is also rich in healthy fats. Others antioxidant foods are included in this diet. Those are food they are rich in antioxidants, mostly berries, colorful vegetables, and your green leafy vegetables, kale, spinach. They're anti-inflammatory. They can have anti-inflammatory properties. Another is the whole grapes like quinoa. Those are very important too. And as you mentioned, some spices like turmeric, it does have an anti-inflammatory. Like ginger, it does have anti-inflammatory properties. Yes, that's not a myth. They actually can make difference. They cannot cure the disease. They cannot stop you from taking medication. Usually, they wouldn't, but they play important role. There are certain foods that definitely have pro-inflammatory properties, like red meat, like sugars, any refined sugar, it is pro-inflammatory. Any ultra-processed food, frozen food, and a fast food, and certain type of red meat as well. And there are some individuals, after some times of living with the disease, people kind of determine for themselves a certain type of food. It does cause them flare up. It's not universal for them. That is like gluten. Gluten doesn't cause flare up for everyone, but some people feel and they're right because it's their body. Maybe gluten is one that, because it's not that close. There are a lot of studies going about ongoing that, but yes, some people can have individual like I hear it a lot. Certain nightshade vegetables, patients say if we eat, next day we have a flare up. And it's true for them. It's not a myth. For their body, we might not know the mechanism yet, but for their body, that's how that's. But they're the ones that I mentioned that we universally we know that they have pro-inflammatory and anti-inflammatory properties. That does matter.
Not one magic food, but a balanced approach.
Yes.
When we're talking about, or when you talk about arthritis, and it's also, I would say, a very common myth. People say, I have arthritis, my joints already hurt. I should not exercise, and exaggerate it more. So, are exercises safe and helpful for arthritis?
That's definitely a myth. Exercises are necessary for arthritis. They're part of the treatment plan. They're extremely important to be part of the routine. And there are multiple guidelines, society guidelines, but to simplify, patients with rheumatoid arthritis, as a lot of other chronic condition, about 150 to 300 minutes of moderate intensity exercise during the week. And that usually involves cardio or aerobic, low impact aerobic exercise. Could be just walking or biking or swimming, and muscle strengthening exercise. It could be weightlifting, or could be isometric exercise when the joint actually doesn't move, but the muscle around it need to be strengthened. It's important. They're not only important to improve the symptoms and prevent function, but also to improve bone health, because osteoporosis is another thing that's consideration with our patients. So yeah, so the main is that moderate intensity exercise, cardio, and muscle strengthening, and it's important, very important, stretching. They have to have a routine of stretching. It could be just home stretching exercise every morning, or it could be yoga or tai chi, but it definitely improves symptoms and joint health. And balance exercises could be also to incorporate. It's always a good idea to have a physical therapist consult in the beginning, because not everyone is at the start on the same level. It has to be tailored to patients' abilities and they're how able where they need to start. Not everyone can start with challenging exercises, but they need to start and have a step-by-step approach to improve. It has to be part of their life.
Okay. Thank you for sharing such an important message and busting that myth. Movement is not the enemy, but you just have to do the right kind of movement.
Yes,
Mhm.
yes, and you have to move.
Mhm.
That's the one important message.
Yeah.
No, movement is good for joints, even if they're sick, if they're not healthy, it's good for them.
So, as we start wrapping up today, we've covered a lot of things. I would like to ask one final question. If there's one takeaway you'd want every listener to remember from today, what would it be?
Yes, one important thing is always seek medical attention, and early diagnosis is important. It can affect the treatment plan and prognosis and quality of life. And we do have very exciting new novel treatments that people have access to, and they should use that to improve their quality of life and prevent loss of function and damage. So seek medical attention if you experience any symptoms that are bothersome enough.
Exactly. Don't ignore persistent symptoms. Don't assume joint pain is just aging, and don't be afraid to ask for help early. Rheumatology is not just about joints, as we've heard today on this episode. If you've been ignoring that morning stiffness, or you know someone who has, share this episode with them. Thank you so much, Dr. Ophelia, for being here and making rheumatology make sense for us.
Well, thank you for this opportunity to talk and hopefully share some important information that would change someone's quality of life and someone's decision to seek medical attention.